Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about complex regional pain syndrome. Although this is a very rare presentation in the lower extremity, it is a really problematic and troublesome problem. Years ago, I had a soldier who had surgery done in Korea. When he came back, he had severe uncontrolled pain. Basically, the symptoms that he have, and I'm going to describe very perfectly the complex regional pain syndrome symptoms. Symptoms he had was swelling that couldn't be explained, mottling in the skin, so it's white or blue or red discoloration of the skin in a mottled pattern. Extreme sensitivity to touch or non-painful stimuli. Abnormal increased sweating, or sometimes even absent sweating. In his case, it was increased sweating to the area. The changes in skin texture, a lot of times it's going to be shiny and thin and tight, which is what we saw in his case. Softening and thinning of the bones, although that was not present in his, this is a symptom that can happen, as well as joint tenderness, which he did have, brittle nails and hair, which he did have, muscle spasms, muscle loss or atrophy, which means the shrinking of that area, which he did see, tremors. The idea is that whole body part becomes unusable. In his case, it was a leg or foot. So with complex renal pain syndrome, you have pain that can't be explained. It's excessive pain for whatever happens. If you have mild trauma, you have severe pain that you just can't explain, and it just doesn't improve. The problem with complex renal pain syndrome is it's not very well understood. They don't know why it happens. And it usually presents very, very rarely. But it's something anytime I do surgery, I will be watching for. Anytime there's trauma, we watch for it. With complex renal pain syndrome, there's two types. One is you have this abnormal pain that can't be explained without nerve injury. 90% of complex renal pain syndrome or Reflex Sympathetic Dystrophy are in this first category. The second category is the same type of severe pain, but you actually have noted nerve injury. So because of that, you're actually watching it and looking for it and making sure that you want to make sure you know which of these categories it's in. Treatment-wise, the best thing you can do is aggressive physical therapy. This is a severe pain. They're not going to want to do things. If you get them into aggressive physical therapy, a lot of times you can knock this down and actually get them back to doing what they're supposed to be doing. So what we watch for is we watch for the symptoms and the signs of complex renal pain syndrome so that we can get this particular pain fixed without continuing to have chronic problems and chronic situations. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 131, Complex Regional Pain Syndrome, a rare disorder where the body overreacts to pain and becomes really a disability and can really interfere with life if it's not treated correctly. This is Dr. Brandt Gibson. Have a great